Greetings all and welcome back to our mini lecture series in AGRC 222 Intro to Vet Science. This is going to be Unit 5 coming at you, again subdivided into two mini lectures. The renal and digestive systems are what we will be chatting about here in this particular section of video lectures. Chapter 6 covers the renal system. Please review that in your textbook. I'm going to hit the highlights here for you in this mini lecture section. So when we talk about the renal system, the basic structures, we talk, of course, first about the kidneys that produce the urine. The ureter is a tubular structure that carries urine to the urinary bladder where it's stored until it's excreted. Urine is pushed from the kidney to the bladder. The urinary bladder then is just simply a hollow organ and has pretty good expansive capacity for storing urine over some period of time. This diagram here on the right side of your slide shows the right and left kidneys, and then it has kind of a cutaway here of the left kidney and what you will see, the medulla, the cortex, a little bit of mini storage area. Of course, we have blood flow that's filtered through there to pull out all of the substances that need to be excreted from the body, and then the ureters that connect to the bladder all the way out to the urethra. So, of course, we can discuss quickly here some potential urinary tract problems that could occur. Again, here's a example here on the right in this photo of an animal that's been dissected. You can see the kidneys with the arrows, those lobular structures on left and right. Here is the venous system that is feeding it, and then the ureter going down to the urethra. So when we talk about urinary tract problems, generally speaking, females have a higher incidence of urinary incontinence or problems with the urinary system. Because males have a longer and more narrow urethra, they're much less likely to have any kind of bladder infection develop and therefore much less risk. But males are also more prone to have obstruction because of bladder stones and things of that nature. Now, let's look at functions of the renal system. Basically, the kidneys are really essential in maintaining balance of water and electrolytes in the system. They help kind of maintain that acid-base balance, that equilibrium that your body tries to maintain most of the time. They're endocrine organs, so they also produce hormones. They regulate calcium and also convert vitamin D for you in the body. Additionally, when we think about the renal system, it excretes nitrogen-containing wastes. Generally speaking, your body can only process so much nitrogen or protein in the body, and any excess protein is really not stored very much. Excess protein in your diet is simply excreted in the form of urea or nucleotides or even creatinine that generally comes from your cellular waste. So, structures within the kidney, I showed it to you earlier on one of the diagrams. We have an outer cortex, a medulla, and then the innermost renal pelvis. Again, we've got nephrons that are in there that help with the filtering process of that kidney. And then here's a dissected, cross-sectioned kidney here to the right. So that nephron is a tubular structure that's closed at one end and opens at the opposite end, again, helping filter and control the inflows and outflows of material out of the kidney. It's divided into three sections that are listed here. That will be important for you to understand what they do. So it's tightly associated with blood vessels. So again, that filtering process that I've been mentioning, useful materials can be reabsorbed back into the bloodstream. So if there's anything, particulates, nutrients, energy that's left there that can be utilized, then the body tries to recapture that if it has escaped into the urine. But more than 80% of the water, sodium chloride, and bicarbonate ions, for example, are resorbed and repurposed throughout the body. Almost all of the glucose and amino acids that might have escaped out into the urinary tract into the renal system and about to be expelled in the kidney, nearly 100% of those are recaptured and repurposed or recirculated into the body. So, of course, how do we go about evaluating urine and blood? Urine is closely tied and a good indicator of what's going on in the blood system. So, urinalysis assesses many aspects of health in the animal. So, visually, you can judge it by color and appearance. Sometimes those things will give you an indication of the health status of an animal. It's typically yellow and should be basically clear. If it gets cloudy, that tends to indicate some kind of urinary tract infection. In addition, we can use test strips to detect a number of different things, whether it's things like glucose and ketone contents, screening for diabetes or ketosis in cattle. There's a simple dipstick, as you can get a cow to urinate and dip that little piece of paper into the urine sample. It may turn purple, indicating a lot of ketones, which is excessive mobilization of body fat reserves because of typically not enough energy consumption in the diet. So ketosis is something that you can check for. Bilirubin is liver disease. If you see a lot of protein in the urine, that generally indicates some kind of urinary tract inflammation. If there's blood in it, there's a number of different things to go looking for, whether it's kidney stones or some kind of tumor or something like that. And pHs are oftentimes an indication of dietary status. We can acidify or make the diet more alkaline and affect things that happen in the body and the blood, trigger different hormones to work appropriately, and so forth. So there's lots of different blood tests that are available to test kidney function. You can do a chemistry profile. You can test for urea and creatinine. Also plays a pretty critical role in maintaining normal blood levels for electrolytes. A little bit on clinical significance, as we've been chatting about all along. Renal failure then happens if the kidneys no longer are able to maintain function. You can have acute renal failure, which is very sudden onset, or chronic renal failure, which is kind of a long-term process and will be indicated. A few things that you may see: bacteria, fungi, or parasites. We have bacteria here in this urine sample to the left, yeast in the center, which was, of course, be problematic, and then trichomoniasis here on the right. Of course, when we're evaluating urine, especially if we talk about the hydration status or dehydration status of an animal, you can somewhat predict what the urinary analysis might come back just by simply checking a few other things on the animal. For example, position in the eye socket. Generally speaking, dehydrated animals, the eyes are sunken in a little bit. They're skin turgor, and what you do to check that is simply pull a pinch of skin, oftentimes done in the neck. And if the pinch stays there, then that indicates dehydrated status on the animal. If it snaps right back into position, then usually the animal has very good hydration status. And even mucous membranes. Whenever an animal becomes dehydrated, their mucous membranes tend to dry up as the body is trying to maintain that equilibrium status. So generally speaking, fluid, if you get into a dehydration status, needs to be administered to correct that problem. So you can look here on the table on the right. If you see eyes sunken in, skin turgor slight to slower, and moist membranes, about 6 to 7% dehydration, all the way down to extremely deep sunken eyes, very slow skin return to normal position, and dry membranes, we might be as much as 10 or 12% low on water, so to speak, in the animal's circulatory system. So I'll pause there, let you get a quick break. We'll stay tuned for mini lecture 2. Thanks for following along.